Hello, my name is Caroline Howard, and I'm the clinical pharmacist here at Carolina Advanced Health. Today I'm going to take a few minutes to talk to you about calcium supplements. I know I've heard about calcium supplements for a long time and had them recommended to me to help prevent osteoporosis. In the last year I've seen them come up more in the news, raising some concerns about heart disease. So I wanted to take a few minutes to talk to you about what risk may be out there and what the benefits would be of taking calcium supplements. So as you may know, the majority of calcium is stored in our bones and then it's released when we need it. So in order to make sure that our body has the right amount of calcium to function properly, the Institute of Medicine has made recommendations about how much elemental calcium we need every day. So for women 19 to 50 years old, 1,000 milligrams of elemental calcium is needed daily. And then for women over 50, we recommend 1,200 milligrams of calcium per day. And so often people aren't quite getting enough calcium, so that's why we've used calcium supplements. So thinking about calcium, you do get some from your diet. You can count on getting about 300 milligrams of calcium from non-dairy sources, but the majority is going to be from dairy sources. So thinking about, maybe you like to drink milk but don't know exactly how much calcium you're getting from that. So in 8 ounces of milk, you get about 8 ounces of milk, you get about 300 milligrams of calcium. And in 8 ounces of yogurt, you get about 450 milligrams of calcium. And I'm looking at a list I have here from the U.S. Department of Agriculture. You can find more information online about exactly how much calcium is in different dairy products. So if you're trying to figure out how much calcium you're getting now, you could go ahead and count about 300 milligrams from non-dairy sources and then add up your dairy sources. So if you found that you weren't getting enough from your diet, you might think about using supplements. And we buy calcium supplements over the counter, and they come in different salt forms. The two most common ones that I think of are calcium carbonate or Tums, or calcium citrate like Citracal. And so they have some things that are different about each one of them. So calcium carbonate has the most elemental calcium in it, which is 40% of it. And that's the amount of calcium that we count up when we're looking at either the 1,000 or 1,200 milligrams that we need per day. Calcium carbonate is more likely to cause like bloating or constipation, and you do need to take it with food in order for it to be absorbed. In contrast, calcium citrate has less elemental calcium. It has only 21% elemental calcium, so you may need to take more tablets per day to get up to the amount you need. One good thing about it is that you don't need an acidic environment. It kind of creates its own acidic environment in order for it to be absorbed, so you don't have to take it with food. Also, if you are taking a medicine that changes the acidity of your stomach, like Prilosec or proton pump inhibitors, things like Nexium, or over-the-counter medicines like Zantac, any of those, then calcium citrate is going to be a good option for you. If you're using over 500 milligrams of supplements, then it's recommended to break them up so you can get the full amount of the calcium absorbed. Now, the reason that you would take the calcium is because you're hoping that it will prevent, fractures in your bones. And so for women who are healthy, dwelling in the community, not to have osteoporosis, we're just not really sure if the routine use of these supplements is actually beneficial in some recent studies that have come out. I mean, at most, it may have like a modest benefit in fracture prevention. So maybe not quite as robust as you would hope for taking all that calcium supplementation. Another thing to consider is that, like I said, the harms that have been raised in the news probably over the past year. There's been a meta-analysis that's come out that showed an increased risk of heart attack for people who are taking calcium supplements alone. And other studies have come out that some are consistent with that. Other ones don't show heart disease risk. So you've got mixed information out there. So I think, we just have to say that the evidence we have is inconsistent. It may or it may not increase heart disease risk. I think all things considered, the bottom line is that it's probably best to get the majority of your calcium from your diet, just like we talked about earlier. And that if you find that you can't get all the calcium from your diet, then you could consider using a supplement. But I would only use like the least amount that you need just to make up the difference to either get to 1,000 or 1,200 milligrams per day. Again, if you have questions about you specifically and your family history or or risk for you, I would definitely speak with your doctor or pharmacist. Could definitely be an individualized decision for every person, but I'd just like you to rethink whether or not you need to be taking your full dose, your 2 tablets every day of your calcium supplement. You may be able to cut back or stop completely by getting the calcium in your diet. Well, thank you for your time, and I hope this has been helpful.